Welcome to Medical Breakthroughs. I'm Dr. Dean Adele. Right now, more than 23 million of us have diabetes. By tomorrow, that number will increase by 4,400. You do the math. It's 1.6 million new cases a year, and every single case needs a very personal attack plan to battle the effects of diabetes.
Come on, baby.
Whether it's type 1 or type 2, people with diabetes walk a fine line.
Good girl.
To keep blood sugar normal, they must balance the effects of exercise, food, and medication. One misstep can throw everything out of whack and create a breeding ground for complications.
I've had 3 surgeries on my eyes.
Blindness, heart disease, kidney damage, amputation, just to name the worst.
There's no simple formula. It's going to be adapted to each person.
People with type 1 need insulin to survive. The more common type 2 diabetes is different.
Most type 2 diabetics will respond to lifestyle interventions.
If people are exercising and dieting appropriately, maybe they'll get away with pills instead of insulin.
Oral drugs and newer injectable medications for type 2 diabetes regulate blood sugar.
Some of those actually tell the pancreas to make more insulin. We have other medications that help the liver decrease the amount of glucose that it makes.
But
the biggest problems we have with the current medications is they don't really treat the basic problem.
the answer may be in an aspirin-like drug called Sosalate.
It has been used historically for many decades to treat rheumatoid arthritis and osteoarthritis and other rheumatological diseases.
Researchers found a protein that triggers inflammation is turned on in overweight people. That inflammation leads to insulin resistance and type 2 diabetes. Sosalate, which is an anti-inflammatory drug, shuts off that protein.
What we've seen in preliminary trials is very positive effects on reducing blood sugar and lipid levels in patients with diabetes.
A multi-center clinical trial is now testing results on a larger scale. Daily blood testing is an unpleasant but necessary fact of life for all people with diabetes, type 1 and type 2.
It's what's going to tell you if everything else is working. If your meal plan's working, if the medication's working.
We recommend they check their blood sugars a minimum of 4 times a day. Frequently, our patients will check 8, 10, 12 times a day.
Because it hurts to prick your finger that many times, there's always the temptation to just skip it.
There are times when my fingers would be just calloused all over because of the glucose sticks.
But now high-tech tools may change all of that.
Continuous glucose monitoring is new technology that allows an individual to basically know his or her blood sugar all the time.
Kelly Pierce has a sensor inserted under his skin. Every 5 minutes, it takes a reading and sounds an alarm if glucose is too high or too low.
I can see when my glucoses are trending down. I can see when my glucoses are trending up.
A recent study funded by the Juvenile Diabetes Foundation found people who use continuous glucose monitoring improves control over their blood sugar. Patients still have to do finger sticks, but not as often.
It's not actually blood glucose testing, it's testing fluid between the cells, but it gives me a good idea of where I'm going so I can take care of problems before they become real problems.
A whole range of devices now offers better monitoring, like ultra-mini monitors to smart models that instantly graph the relationship of food, exercise, diet, and medication to the user's blood sugar. Even cell phones
Hey!
can track blood sugar.
It's calling for my sugar reading.
Lori Fales is part of a clinical trial that turned her cell phone into an interactive diabetes monitor.
What do we all walk out the door with every morning and checking to make sure we have? That's a cell phone.
Lori does her normal glucose test and enters its results and other data about what she eats and how she exercises into the phone.
It comes back and tells the patient, your blood sugar is just right, it's a little high.
I feel like for the first time in 20 years my diabetes is managed.
Another recent management breakthrough, meters that communicate with the insulin pump.
Put the little drop of blood on the test strip, and then the meter will send the results to your pump. And then you tell the pump, okay, calculate how much I should take to correct this high blood sugar. And this is reading as 119, and you see how it showed up right on your pump.
Patients then instruct the pump to give the recommended dose of insulin.
Now it's going to give you 0.5 units. So go ahead, because the goal blood sugar is set at 100. You always can override it, so you know that I'm going to go out and exercise in 15 minutes, so I don't want to correct the whole blood sugar because I want to make sure I don't get low while I'm exercising.
So while diabetes remains a challenge, lifestyle changes and technological tools arm patients to battle it.
You need to take it seriously, but don't let it overwhelm you. Use the technology to the best of your ability. Learn as much as you can, and take it day by day.